You've been told it's just anxiety. Maybe you've tried therapy, maybe you're on medications. But what if your anxiety isn't just a mental health problem? What if the real problem is from your thyroid, your blood sugar, your hormones, or your micronutrients? Just like my patient who was told by 3 different doctors it was just anxiety until we ran one simple test. Hi, I'm Dr. Air, integrative psychiatrist and lifestyle physician. Today, I'm revealing 7 hidden medical causes of anxiety that most doctors completely miss. We'll walk through the most overlooked medical triggers, what tests you need, and what you can do about them. Let's start with a quick story about 46-year-old Sarah. For 2 years, she had been struggling with severe anxiety, excessive worrying, heart racing, poor concentration, feeling on edge, sleeping poorly. She saw 3 different doctors. All said the same thing. It's just anxiety. You need to manage your stress better. When she came to me, she was completely defeated and felt like she was losing her mind. Here's what was missed. Anxiety isn't always a brain problem. Sometimes it's a body problem that shows up as anxiety. Your brain responds to signals from your thyroid, blood sugar, gut, and hormones. When the systems are out of balance, your brain sounds the alarm, and that alarm can show up as anxiety. Think of it like a smoke detector. The alarm isn't broken. There's actually smoke somewhere in the house, which is why it goes off. The first hidden cause happens multiple times a day, and you probably don't realize it's triggering your anxiety. Number 1, blood sugar instability. When your blood sugar drops too low, your body releases special hormones to help restore it. These hormones include adrenaline, cortisol, glucagon, and growth hormone. This response can produce symptoms that overlap with anxiety. You might get shaky with racing heartbeats, sweating, and nervousness. Your body is actually trying to help you by releasing these hormones. They're working to bring your blood sugar back up to a safe level. But the problem is, these physical findings can seem exactly like anxiety. A few signs that your anxiety might be caused by blood sugar problems include the following. You feel anxious 2 to 3 hours after eating. You get shaky, cranky, or anxious when you skip meals or eat late. You feel better after you eat something. You wake up between 3 and 4 a.m. with a racing heart or feeling anxious. You crave carbs like bread, pasta, or sweets when you're feeling anxious. It is important to know that while some people do feel more anxious in the morning, doctors haven't proven that this is always due to blood sugar issues. Also, most people don't feel symptoms until their blood sugar drops to around 60. Sometimes people think their blood sugar is low when it's actually normal. They're just extra sensitive to the hormones their body releases. Here's what to do. Eat 20 to 30 grams of protein with each meal. Avoid high-carb breakfasts. Follow up with your doctor for the following lab tests: fasting glucose, fasting insulin, hemoglobin A1C. When we stabilized Sarah's blood sugar, her anxiety improved significantly. But that wasn't the whole story. The next one is especially common in adults over 40, and it's one of the most misdiagnosed conditions. Number 2, thyroid dysfunction. Your thyroid is like the gas pedal for your metabolism. When it's overactive, hyperthyroidism, everything speeds up. When it's underactive, hypothyroidism, everything slows down. Both can cause anxiety. Hyperthyroidism causes racing heart and palpitations, tremors and shakiness, insomnia and restlessness, heat intolerance, weight loss despite eating, feeling wired all the time. This feels exactly like anxiety, but it's your thyroid revving your nervous system into overdrive. Now remember Sarah, the woman 3 doctors told her was just anxiety? Here's what one simple test revealed. We ordered a full thyroid panel, not just TSH, but free T3, free T4, and antibodies. Her TSH came back very low. Her free T4 was elevated. Heart rate at rest, 95 beats per minute. She had hyperthyroidism. Her overactive thyroid was flooding her system with hormones, causing her racing heart, disrupted sleep, and anxiety. Once her hyperthyroidism was treated, her anxiety improved significantly. No increase in psychiatric medications, just treating the root cause. This is why testing matters. TSH, free T3, free T4, thyroid antibodies. Number 3, hormonal shifts. This affects many women in their late 30s and beyond, perimenopause and menopause. Estrogen regulates serotonin, your feel-good brain chemical. Progesterone regulates GABA, your calm down neurotransmitter. During perimenopause, these hormones fluctuate wildly. Your brain struggles to keep up with the erratic hormone levels, so it stays on high alert. Research shows women are twice as likely to develop anxiety during perimenopause. This isn't a coincidence, it's biology. Red flags include the following. Anxiety started or worsened in your 40s. Worse during certain cycle parts. Hot flashes, night sweats, irregular periods. Wake at 3 a.m. drenched in sweat. Feel like a different person before your period. Sarah had this too. We tested her hormones. Her progesterone and estrogen were very low. Once we addressed her progesterone and estrogen deficiency and treated her thyroid, her 3 a.m. wake-ups stopped within a few weeks. Number 4, chronic inflammation. Inflammation in your body creates inflammation in your brain. This can contribute to anxiety. When your body is inflamed from poor diet, stress, toxins, lack of sleep, or gut issues, it releases inflammatory chemicals called cytokines. This cross the blood-brain barrier, affect how your brain responds to neurotransmitters, and keeps your nervous system in constant threat detection mode. Think of your nervous system like these blocks. When stacked properly, everything is stable, but inflammation removes the foundation, making things unstable, and your brain stays on high alert. Studies show people with anxiety often have elevated inflammatory markers. One study found that reducing inflammation improved anxiety without psychiatric medication. Red flags for chronic inflammation include joint pain, skin issues, digestive problems, feeling worse after certain foods, tired despite sleeping, brain fog with anxiety. Here's how to reduce inflammation. Consider an anti-inflammatory diet. Cut back on sugar, processed foods, and seed oils. Add leafy greens, berries, wild salmon, turmeric, and olive oil. Prioritize 7 to 9 hours of sleep. Walk 20 to 30 minutes daily. Talk to your doctor about lab tests like HSCRP. Number 5, gut-brain dysfunction. Your gut and brain are in constant communication. When your gut is unhappy, your brain feels this too, and this can show up as anxiety. Your gut has over 100 million neurons, more than your spinal cord. Your gut produces 90% of your body's serotonin. It also produces GABA and dopamine. When your gut is out of balance, this affects the communication with your brain. Research shows people with anxiety have different gut bacteria than people without anxiety. There's also leaky gut, in which the intestinal lining becomes permeable, allowing toxins into your bloodstream and triggering inflammation. Red flags include the following. Anxiety worsens after eating. Bloating, gas, constipation, diarrhea. Multiple rounds of antibiotics. Food sensitivities. Constant sugar cravings. Here's how to heal your gut. Minimize sugar and alcohol. Add bone broth, fermented foods, collagen. Take a high-quality probiotic. Number 6, nutrient deficiencies. Your brain needs specific nutrients to make calming neurotransmitters. Without them, your brain functions suboptimally. Let's start with magnesium, often called the relaxation mineral. Magnesium calms your nervous system, helps you sleep better, and regulates cortisol. Many American adults are deficient in this important micronutrient. The best test for magnesium is red blood cell magnesium. If you're deficient, supplement with magnesium glycinate 200 to 400 milligrams before bed. Next are the B vitamins, specifically B6, B12, and folate. Your body needs these to make serotonin, dopamine, and GABA. You can test your levels with B12, folate, and homocysteine tests. If you need to supplement, use a methylated B complex. Vitamin D is another critical nutrient. Low levels are strongly linked to anxiety and depression. Test with a vitamin D test. The optimal range is 50 to 80 nanograms per milliliter. If you're low, supplement with 2,000 to 5,000 international units daily. Make sure your vitamin D supplement contains vitamin K2. Iron, measured as ferritin, is also essential. Low iron causes fatigue, brain fog, and anxiety. Have your doctor test your ferritin levels. If you're deficient, supplement with iron bisglycinate. Finally, omega-3 fatty acids are anti-inflammatory and essential for brain health. Supplement with high-quality fish oil, 1,000 milligrams of EPA daily. Number 7, sleep disorders. If you're not sleeping properly, your anxiety will likely remain a struggle. Poor sleep is both a cause and consequence of anxiety. When you don't sleep, your brain chemicals do not function optimally. Your amygdala, the fear center, becomes hyperactive. One night of poor sleep can worsen anxiety the next day. Chronic sleep deprivation makes the situation worse. Here's how to optimize sleep. Keep bedroom cool, 65 to 68 degrees Fahrenheit. Make it completely dark. Same sleep-wake time daily. Avoid caffeine after 2 p.m. Take magnesium glycinate before bed. If you snore or wake unrefreshed, get a sleep study. Now here's something very important. It is what is known as the stacking effect. This means your anxiety is rarely due to just one cause. It's usually 3, 4, or 5 stacked together. Sarah didn't just have thyroid issues. She had blood sugar instability, low progesterone, magnesium deficiency, poor sleep, and gut inflammation. This is why treating anxiety with just medication often doesn't fully work. If you don't address the root causes, you'll never fully heal. You have to look at the whole picture: thyroid, hormones, blood sugar, gut health, inflammation, nutrients, and sleep. If you're struggling with anxiety and poor sleep, I've created a free guide with my exact protocol for resetting sleep naturally. The link is in the description below.